Just wait a few minutes. All right. Hi, everybody. My name is Garrett Stanwyck. I'm VP of Operations at Within Health. I'm pleased to announce our presenters for today, both of them coming from Project Heal, who will be discussing making eating disorder treatment access equitable. A little bit about Project Heal. Is a nonprofit organization in the U.S. focused on equitable treatment access for eating disorders. The organization's mission is to break down systemic healthcare and financial barriers to eating disorder treatment. And the mission is delivered through 4 core treatment support programs: insurance navigation, treatment placement, cash assistance, and clinical assessment. Project Heal is also very active in research, education, and advocacy at the national level. Our first presenter is Rebecca Eyre. She's the CEO of Project Heal. She joined Project Heal in the spring of 2019 as a treatment access program director, and within a year, against the backdrop of a global pandemic, she stepped into the CEO role. Rebecca is a therapist by trade, having treated eating disorder and trauma since 2011, and she brings a clinical lens and a programmatic focus to her leadership of the organization. Her background and experience ranges from eating disorder treatment settings to corporate philanthropy at Microsoft, to academic fundraising, to strategic marketing, and all the way through the tech startup world. Our second presenter is Serena Nangia. She's the marketing and communications manager for Project Heal. Serena believes that activism for social justice is crucial to making the eating disorder world more accessible and redefining what a person with an eating disorder looks and acts like. She's been working as an advocate for eating disorder recovery for over 8 years, since she was 15 years old. Prior to joining Project Heal, Serena worked in various marketing roles for a recovery coach, multiple international nonprofits, and an eating disorder treatment center. And without further ado, I'm going to turn it over to you ladies. Thank you so much for being here today, and looking forward to the discussion.
Thanks, Garrett.
Thanks for having us. I am really excited to be moderating this discussion, fireside chat with my supervisor and the best boss ever, Rebecca Eyre. So we're going to be diving into a few different things, but mainly about what leadership in the eating disorder field can and does look like, especially at Project Heal, and how we can make treatment access more equitable. So, Rebecca, like Garrett said, you became CEO in the midst of the very beginning of the COVID-19 pandemic, and life since 2020 has been a lot, especially for nonprofits. Can you tell us some of the story of how you became the CEO of Project Heal, and you and the board's vision to make the switch to a more equity-focused mission and vision?
Yeah, absolutely. Honestly, it was a wild ride. Like I said, or like I was introduced, I'm an eating disorder therapist by training, and I actually had taken a break from the eating disorder field after 5 years at a treatment center, and I needed a breather. I was in kind of corporate world. I was doing strategy and marketing, and I was considering returning to clinical work, but I wasn't sure exactly what that would look like. And so I'm actually telling how I got involved at Project Heal, and then I'll say the CEO story. So then I heard about this treatment access program director role through a friend who was actually applying for the job too. And so I was helping them with their application process, and I knew a lot about this issue because I had worked in admissions at a treatment center, and I saw firsthand how many people we had to turn away, how many people called and tried to schedule an assessment or get into treatment who we had to essentially decline to assess because they had an insurance that we didn't accept, like Medicaid or Medicare. People who I did assessments for who definitely had eating disorders and deserved care, but we knew based on their insurance, we couldn't get them authorized. And so we would refer them out to outpatient care, and just all of the things that got in the way of us actually being able to get people in the doors of treatment. And so I became unfortunately familiar with essentially how the eating disorder treatment landscape back in the early aughts was working. And so when I heard about this role, I was really interested in it. My friend ended up not getting it, but ended up copying me on their rejection letter to Christina Saffron, the co-founder of Project Heal, who was the CEO at the time, and said, I totally understand why I didn't get this role, but You have to talk to my friend, Rebecca. She's perfect for it. So I was like, okay, here we go. So I interviewed, I know that Christina and the team had taken a full year to fill the position because they really wanted someone who understood the eating disorder treatment landscape. And I think about it like this, like there's the mental health field. Sorry, my background is making my hands disappear. There's like the mental health field. There's like people who understand eating disorders within the mental health field is quite narrow, which is one of the problems we're trying to solve. And then the people who understand eating disorders, but who also understand eating disorder insurance is even tinier. And I was one of those people. And so I was like, let's do this. So anyway, I got the treatment access program director role back in, I think, April of 2019. And a few months later, Christina Safran, again, our co-founder and longtime CEO, announced that she was leaving to start Equitable, which is somewhat of a similar business model to Within, with some differences for sure. Both of them, I think, approaching eating disorder care really innovatively, and I'm so glad that both of them exist. So she was leaving, and I was like, oh my goodness, what's going to happen to Project Heal? And they went through this long process of trying to find the right CEO to replace her. And the board was really focused on a seasoned fundraiser. They wanted someone with a proven track record of growing a nonprofit. And I was not a seasoned fundraiser. I'm a clinician. I'm not a nonprofit executive, right? I'm not a professional fundraiser. And so I didn't apply. And they ended up actually hiring someone who was a seasoned fundraiser and had a proven track record, but who didn't understand the eating disorder field. That person started in December of 2019 as Christina exited, and wonderful person, but not deeply understanding eating disorders, really not understanding eating disorder treatment, not understanding the barriers, and not understanding all the nuances of the field, really set them up to not necessarily get off to like the strongest start. And so unfortunately that was happening right at the very beginning of 2020. And so by the time March hit and we're all in lockdown and we can't do any events and we're all working from home and we have no idea when this thing is going to end, the board started kind of panicking and trying to figure out what in the world we were going to do. And so the board approached me and said, what do you think Project Heal could look like? What would you suggest if we had to scale back significantly, right? As a nonprofit, we have to figure out like how to make sure we're kind of financially sustainable. We are entirely donations based. And if we can't do in-person fundraisers, and if everybody is going to be focused on this public health crisis of a pandemic, like how do we get people to care about eating disorders and how do we get them to prioritize eating disorders in their philanthropic endeavors? And the anxiety of that was a lot. And so we basically decided to kind of cut Project Heal in half. And that was my proposal. At the time, we had our treatment access program, which was helping people get into treatment who couldn't access it primarily for financial and insurance reasons. And then we had our Communities of Healing program, which was peer support, both individual and group. Both of those programs are important. The treatment access program was at the heart of why Project Heal was founded, but Communities of Healing was really close to Christina's heart because, she really believed in peer support and lived experience as a primary kind of heart of what helps somebody kind of actually heal. And so, Communities of Healing was a beautiful program, but what I saw clear as day is that we weren't doing both of those programs the justice that they deserved, right? Like we couldn't do both, especially at the amount of money that we were raising, which was under $1 million. And I know that might sound like a lot of money to the everyday person, but it's a very tiny nonprofit and you really can't do a lot with $1 million. And not knowing if we would raise money that year, we had to decide like, what does a half Project Heal look like? And I wasn't willing to essentially have, this is a kind of crass metaphor considering the field that we're in, but I was like, why would we have like two starving programs instead of doubling down on the one program that is probably going to be needed the most? And I was looking around seeing so many of my friends getting laid off and losing their insurance And I saw people's eating disorders start getting really activated in the isolation and the fear of our food system disruption. Everybody remembers going to the grocery store and like stockpiling all this stuff because we had no idea, we were in this kind of collective panic. And I saw clear as day that, Project Heal was founded to help people access treatment. It's the heart of what we do. And it's something that nobody else was doing. Whereas peer support is something that a lot of other organizations do, right? ANID has been doing it for 45 years. Organizations like the Eating Disorder Foundation does it really well. Fed Up has peer support led groups. Like there's other places people can turn for peer support, but there really aren't a lot of other places that you can turn if you can't access eating disorder treatment. There's like a couple of small funds, and most of the time when I check their websites, they're like applications are closed until further notice, right? Like we're genuinely the only place that people can turn if they can't get in. And so I thought it was really important to focus on that. And that was my proposal to the board. And they took a huge gamble on me. Being a programs person, that I think resonated with them, but scared them because I couldn't promise I would succeed. I didn't know where we would get the money. I didn't know whether it would work. All I knew is what the community needed the most. And so I was hired in April of 2020 to be the CEO. And, I've never been a CEO before. And I was genuinely like, I hope I do okay. Like I wasn't like selling myself very strongly. But quickly, I think we saw that the vision that I had made a lot of sense for the moment. And not so soon after that, right? It was May 27th, 28th, 29th that George Floyd was murdered. And some incredible leaders, Alicia McCullough and Jessica Wilson, started the Amplify Melanated Voices movement. What I find really stunning is that this nationwide call to action was started by two Black eating disorder dietitians, and it far expanded beyond the eating disorder field. It was a national movement, and a lot of people didn't know that it came from the eating disorder world. And I thought it was really powerful that it did. And Project Heal and I took that really, really seriously. I had been thinking a lot about racial justice for years prior, but frankly, hadn't thought a lot about it in the context of eating disorder care. And it became really clear that it was connected to what we were doing. And so we started infusing and thinking about, who's here, who's in the room, who's in eating disorder care, who's providing eating disorder care, who's least likely to access it, where are these intersections? And it became really obvious that, Project Heal's past focus on financial and healthcare barriers to treatment, super real. Across the board, eating disorder treatment is expensive. Insurance sucks for covering eating disorder care unless you have platinum insurance, regardless of identity. But you can also see when you overlay, gender, race, disability, how much less likely you are to have that platinum insurance without those identities because of the systemic inequities in our world. And so we started to kind of understand that our services needed to center marginalized folks and not the traditional eating disorder stereotype. And I think that set us in a really different direction than we had been in before. And frankly, I think the universe all the time for the racial justice movement of 2020, because it allowed me to put my foot on the gas pedal of becoming a really progressive, social justice oriented eating disorder nonprofit in a way that I know for sure would not have landed as well or felt as obvious or gotten the green light from a board if it weren't for a genuine sense of urgency that the entire country was experiencing. And, I think about replacing a shiny, sparkly founder and CEO like Christina Saffron and having radically different ideas is not something that people, feel safe doing quickly, which is why change has been so slow in a lot of places in this country. There's a lot of fear-based decision-making. And I think fear kind of went out the window because we were in crisis as a country and we all knew it. We were having the same conversation for the first time in a long time. And I think it gave me a ton of leeway to do some pretty bold things I don't think I would have been able to do in any other circumstance. So that's a long answer to your question. Oh no, I think you're frozen. Unless it's me who's frozen.
I think she might have froze.
Okay. Well, I'm happy to continue. And actually, while we're waiting for her to get unfrozen, I want to just make a note to anybody who's watching right now. We have a good 15-20 minutes at the end of this for Q&A. So please do submit any questions you have for me or for Serena in the Q&A, because we'd love to make this more dialogical. I love that Serena was frozen on such a sweet face, though, at least. Oh no, she's gone. She'll come back. I happen to know what the next question is because we have them prepared. So I'll ask it of myself so we can keep going. Oh, here she is. Hi.
Hi. Perfect timing for me, for my Wi-Fi to cut out. I think it's really important how the eating disorder world intersects with the rest of the world. And as you know, we talk about this a lot, like you, Rebecca, as a person, represent a lot of the stereotypes of someone who has an eating disorder, but being able to highlight the voices of people who we've brought onto the board and changing this focus to a more equity focused approach has just been so powerful. And you have played a really integral role in the field as far as I'm concerned.
Oh, thanks. I mean, I think what I will say is I'm palpably aware of how problematic it is that I'm the CEO of a progressive, social justice oriented eating disorder nonprofit with my identities. And I think that, to be honest, it's one of the hardest parts about my role. And I think a lot about my succession plan. And I really want Project Heal to be in a super stable and financially sound place before, I transfer the role to someone whose identities align, I think, with the people who we're trying to serve more powerfully. And I'm really excited to do that. And in the meantime, I think this is where representation matters, and also where you can, I think, veer in towards tokenism. It's like, I could easily just say, I'm stepping down, let's plug this, person in with multiply marginalized identities. And I'd be handing them an organization that's in flux, we aren't sure where we're going to get our money. We're not sure whether we're going to hit our revenue goals. We're not sure how sustainable this is, because we're still up against a lot of barriers from helping people understand the issues that we're trying to solve. And so I don't know that it's that kind, loving, or helpful to hand someone the ultimate responsibility of primarily fundraising when it's not, where I think it needs to be in order to be, I think, a healing and secure transfer. But I'm aware of I think the ways in which I'm able to do what I do well because of some of my privilege. And I'm also not the right person to do what I do well because of my privilege. And I think about that all the time. And it's really closely at the heart of my own personal work. And it's not a one and done consideration. It's constantly on my mind. I think about it a lot. I think one of the ways that I've attempted to resolve it in the meantime is I've surrounded myself with remarkable people, and incredibly, I think, representative staff and board who I really lean on and listen to and take the guidance of. And I don't have an authoritative approach to my leadership style. And so it's I want to absorb the burden and the responsibility, but I don't want to hold the power, if that makes sense. And I think that does hopefully show up in how I actually lead and manage and and build what we're trying to do.
Yeah, I think that that's pretty unique for a nonprofit or a for-profit, that the leader is so very aware of their positioning, but also doesn't want to hold power forever. I think that's
Well, I don't even want to have any power right now. I really don't. Like, I barely want to be here talking about this, but I do think it's important because the eating disorder field is filled with people who look like me, right? I go to these eating disorder events and I go to networking things and I go to conferences, and it's a sorority. Every single person for the most part could be my sibling. And I'm just like, if a field, mostly looks like me, like, I think that it's helpful to hear how I resolve the issues that each of us are hopefully wrestling with, and like try to help us figure out how to do better and how to change and like how to do that sustainably.
I agree. We can learn a lot from you. And look, I don't have to hype you up, but I will. So with all of that said, like, what is the importance? I know you've touched on it, but like, why should other people, why should treatment centers, why is equity so important and taking that approach so important in the eating disorder field?
Well, I want to answer this question, but I want to make sure we get to the other questions from before this. So come back to, because I want to talk about Project HEAL's responsibility for its past. But
Yeah.
as far as the equity related approach, I really want to just take a minute to actually read our most recent iteration of our Equity Matters value. So as part of our transition in 2020, we revised our mission, we revised our vision, we revised our values, we transformed our branding to be more, I think, gender and age and in general inclusive. We had a like pastel butterfly before, which some people have tattooed on their bodies, and I love that for everybody. And it was quite young and quite feminine, and I don't think signaled to the people who we wanted to reach that we were a resource for them. And so anyway, we also revised our values. And so we had a version of our 4 values, and one of them was Equity Matters. And just recently we went through a whole revision process with our staff where everybody contributed, what equity actually means to them. And we teased it out and found the right words. And so I'm actually obsessed with this definition, and I want to just define equity for Project HEAL before we dive into why I think it's important. So Project HEAL exists as a resource for all people struggling with disordered eating in the United States. We believe that equity is a restorative process, not an event. In contrast to equality, equity is aimed at a just distribution of resources that acknowledges inherent inequity in our existing systems. Equity is not a punitive process, nor an inversion of the existing hierarchy. In order to create a world where everyone can experience the eating disorder healing they deserve, regardless of age, race, gender identity, sexual orientation, size, health, ability, or financial means, we strive to ensure that Project HEAL's limited resources are leveraged to create the most meaningful impact for the system, for those the system is most egregiously failing. We use an intuitive, individualized case-by-case approach and intentionally prioritize those who have been excluded from or harmed by the eating disorder field due to biases like racism, weight discrimination, transphobia, homophobia, ableism, healthism, and classism. And I think that definition of equity is important when we talk about Project HEAL's mission to create more equitable eating disorder treatment access. A lot of people can't access eating disorder treatment. Of the 30 million people in the United States who will be diagnosed with an eating disorder, which, by the way, the diagnosis system is also inherently inequitable, even of those who get access to a diagnosis, less than 20% of those people ever access eating disorder treatment. And so if we are a small eating disorder nonprofit with limited resources, how do we make sure that our limited resources are going to the people who need it the most? And equity is different than leveling the playing field. It's literally like disproportionately providing resources to those with the least so that we get closer to something like justice. It's an acknowledgement of past inequities. It's an acknowledgement of systemic inequities. And so it's not, a blind process. It's actually deeply considering a constellation of factors and understanding how much more disenfranchised, under-resourced, under-supported, and excluded huge swaths of the eating disorder population have been in eating disorder care, and making sure that they're at the center of our efforts. Certainly never denying resources to someone who fits the stereotype. Absolutely. If they're low income and their insurance won't cover it, we're happy to help them. They're a big part of what we do. But we don't exist solely for them, as most of the eating disorder field does. And I think that's a really important differentiator in our value system and how we approach our distribution of treatment access resources.
I agree. It's a really unique model that you've basically created in the past few years from the great foundation that our founders created. But we have had our pitfalls as well as a nonprofit. And like we said, in 2020, there was a big change to focus on equity. But before that, we experienced a lot of the things that some other places in the eating disorder field are currently still experiencing, and that, you know, we still experience our own pitfalls as well. But what are, you know, how can we acknowledge and take responsibility for any of the inequities that we have encouraged in the past while still moving forward as this equity focused organization?
Well, I think that one of the things that's the most obvious to me is that if we want to reach people who have long felt like they weren't a part of the eating disorder community, and basically haven't even dared have the imagination that they could be part of it, that they could be worthy of care, that they might even have an eating disorder in the first place, we have to like deliberately go above and beyond to indicate that this is a resource for you, that this is a safe place for you. This isn't like the solution of like, we're here for all people, doesn't go where it needs to go for people who have been systemically excluded from access to healthcare, and especially the eating disorder field. Like that stereotype of what an eating disorder looks like is so deeply ingrained, and it remains a huge part of even current insurance authorization practices. It remains a huge part of current eating disorder treatment models. And it can't be resolved by just saying we're here for everybody, right? So I think if you actually want to build trust with people who actually don't trust you, it's not that they, you know, it's hard to say, but it's like, imagine if there was a club and it wasn't just that you weren't in the club, it's that you had been told over and over again you weren't welcome in the club. You'd need a long reparations and like repair process with those people in order to say, no, 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 we mean it when we say this is safe for you. You can't just put a sign up and say, now accepting all new members, right? Like you have to essentially account for the fact that you know, inadvertently or deliberately participated in a system that made them feel like they didn't, that it couldn't possibly include them. And so I think, you know, Project Heal was founded by two teenage girls, white, affluent, anorexia survivors who met in treatment because they could afford it, right? We were founded by the definition of the stereotype, and you know, they're remarkable people, and they always acknowledged that they fit this stereotype. I mean, at least as far as I know, in terms of what I've heard them say, right? There's an acknowledgement, but I thought it was, but it didn't bleed out. It didn't go that step further to deliberately center people who didn't fit the stereotype. And I think for that reason, you know, well over 90% of our beneficiaries for our first 12 years looked like them, because people could see Project Heal's website and branding and see themselves, and that's who applied for our care. And since we've changed our branding and our language and deliberately centered those communities, our demographics are dramatically different. And it's because I think we've gone out of our way to center them and to talk to them and to account for it. I think, you know, I inherited mostly white board. I had 7 board members, 6 of them were white. All of them had a mission connection of anorexia. All of them were straight, all of them were cis, all of them were wealthy, right? Like it was a very typical nonprofit board. And I remember vividly, because it was actually on my birthday in 2020, I was like trying to have a moment of joy. And I remember Fed Up, who we are now deeply good friends with, posted this like call out post, essentially, you know, talking about all the eating disorder nonprofits and their board composition and staff composition. And we did not score well. And I was like, first of all, it's a Saturday night, it's my birthday. I don't want to think about this at this exact moment, but on Monday morning, I'm hitting the ground running. And it took me about a year to find the people, build the relationships, build the trust. And I was able to turn our board into the most diverse nonprofit board in the eating disorder field. And it's continuing to do that. And I think diversity is only one of those letters in DEI. So I'm very proud of the representation that our board and staff has. And we've built in a ton of equitable hiring practices, but you know, people being in the room and at the table is just the first step. It's how safe is that place for them to speak up? It's how much they feel like they don't have to code switch in order to participate in conversations. It's how much power they feel like they have to actually influence our processes. And that's been a big part, I think, of undoing the inevitable harm that, you know, homogenous leadership creates. Because we had, I think, an exclusively anorexia experienced board, we didn't think that much about, you know what I mean? Like, and I'm saying we, because I'm talking about Project Heal. I wasn't here at the time, but I'm like, you can't expect them to do phenomenal work around racial equity and gender inclusion and weight stigma when they have no personal drive to do that because it hasn't personally affected them. And so that I think has made a really big difference. And we've invited not only our board, but a program committee that's exclusively marginalized folks to participate in reviewing every single aspect of our application process and our treatment access program mechanics and figuring out how to make sure that these programs are getting to the people that they need. And I think I'm off of your original question of like, how do we take accountability? But I think it's a long process. I mean, I'm at 2.5 years in my role, and I feel like I'm still just getting started. You know, I feel like I'm a lot further along than most in terms of getting the right people in the room, but we still have a lot of equity and inclusion work to do. And it takes a long time to build trust. One of my mentors is a man named Milton Reynolds, who he's like my leadership coach and also a DEI educator that Project Heal has partnered with. And that's an ongoing multi-year relationship. That's not one training that we've done. And I process all kinds of things. And, you know, he has said this beautiful thing, which is change happens at the speed of trust. And I think people who, especially privileged people and white people, get into, you know, especially in the summer of 2020, we're like, okay, we're going to do this thing. And they really want it to be kind of like a diet. They want it to be like an overnight transformation, a New Year's resolution where it's like, I'm now going to be different. And it's like, no. This is like a years long process. And if you think you're done, you're not doing it right. And I don't think we're where we need to be. And I don't think that we're even close, but I do think that we have people who are helping us get it right and stay in the tension and the discomfort and like in the process of it. It's like, it's way too nuanced and like, it's a whole body revolution. You don't just like do it in an afternoon. You have to reckon with a lot of stuff, even on an individual level, but organizationally, that takes time. It takes time, and it takes a lot of time to repair trust with people who have felt harmed, even if you didn't think, you know what I mean? Like, it's like, they might not even be telling you that they feel harmed, but like, we need to assume that we have harmed people. We need to assume that we have excluded people. We need to assume that people don't trust us. And we need to think about, what does trust repair actually look like? And it's not an overnight process, and it's not a 1 year process. And it's not like, it's not something I would even dare to imagine I'm close to. I don't even know what finishing looks like. It's like values. If anybody watching this has worked with ACT, it's like, it's not a goal. It's a North Star that you're always reorienting yourself toward, and seeing the ways in which you're not aligned, and not panicking, just doing better as soon as you notice, and taking accountability for the fact that you simply aren't going to be embodying those values all the time. And it's part of it. And I think you have to remove your ego from it. And I think that's one of the hardest parts for a lot of privileged folks in this field, is like, it requires an ego death. And I'm here for that. It's not like fun, but it's really good.
I bet I feel like we haven't talked about this, but I feel like as a CEO, there almost requires some level of, this is my personal opinion, like ego. Like, you have to have some level of, maybe it's not ego, but like confidence in, your leadership, and then being able to do that at the same time as laying down your ego, I'm sure is a difficult internal process for leadership.
Yeah, I have a therapist. I think that having a baseline temperament that isn't seeking status helps. And I think that's why I was an unlikely CEO, and also why I'm excited to think about my succession plan, and why, I think my vision for Project Heal is that we don't exist in 10 or 20 years. I don't want to build Project Heal up to be an essential part of a broken healthcare system. I want to heal the healthcare system so that we don't even need to be here. Like, it's like part of what keeps me up at night, is why we even need to be here. We shouldn't have to be here. Eating disorders exist. They always have, they always will. They don't need to be nearly as pervasive as they are. Our culture does a really bad job at creating healthy relationships with food, but our healthcare system is so far off the mark when it comes to eating disorder treatment and healing. And I think if we're not, at the same time as delivering direct services, trying to actually repair the system, then we're really building up our own brand, you know what I mean? Treating ourselves like a company. And I'm like, I want to work myself out of a job real bad. I'm heartbroken that we have to be here.
Yeah, I agree. I think one of the best metaphors that that I share frequently with people outside Project Heal is, we are in the boat is sinking, and as the boat is sinking, we are trying with our direct services to plug the holes, but at the same time, we're trying to build a new boat, essentially, is what I like to think of it as. We're trying to help people with what the resources we can, and surviving and experiencing the least harm in treatment, and getting better and healing, hopefully. And then at the same time, building a new system, or even trying to fix the sinking ship as it's sinking, it's a lot to be doing, but it is an important responsibility. And it would be great if the boat just worked, and if in 10 years the boat just was there and we didn't have to do anything.
And that's that's Project Heal's vision. And that's my vision for Project Heal is like, it's not, I think a lot of people talk about eradicating eating disorders. And I simply don't agree with that just based on what I understand about the human experience. I think food is a really understandable way for people to process and to cope with uncopable life experiences. It's a brain illness, it's genetic. Like I don't think that eradication, it feels like a great use of my energy, but we should absolutely live in a country where the second that someone starts exhibiting signs and symptoms of an eating disorder, that it's spotted, that they're able to immediately feel held and understood by their loved ones, where you can immediately access treatment and that treatment works. And the eating disorder becomes a very survivable, treatable illness that has adequate resources to be kind of managed and or totally healed. And that eating disorders aren't a life sentence or a death sentence. They're to be expected, they're well understood, they're fully treatable. Like that's the world I'm imagining, and where people don't have to go into debt or take out loans or suffer alone. Like there is absolutely no reason for anyone with an eating disorder not to have the resources and opportunities they need to heal in this country. We have more than enough money. We have more than enough knowledge. We have the best, even though it's so messed up, some of the best healthcare, on the planet. And it's outrageous how far from, I think, adequate we are when it comes to eating disorder care. I think it's telling to think about, the Kennedy Forum is an organization that's focused on mental health parity, and they have been for a very long time. And they have told us repeatedly that eating disorders are the most egregious mental health parity violations in the world. And it's the most inequitable space in mental health care. It's like this field needs to be thinking about like why that is and how we can become like other mental health diagnoses that are well researched, well resourced, that treatment is everywhere, it's diverse, it's intuitive, it's patient centered. Like these are things that other diagnoses have figured out, and we have not figured that out for eating disorders. And I think our failure to do so is costing people their lives, and we should take that really seriously.
I agree. Thank you for that. I want to call for questions. If you have any questions, feel free to put them in the chat or in the question and answer situation on Zoom, and we would love to answer some questions at the end. And we'll definitely have some time, so please feel free. I want to we've talked a lot about Project Heal and the process that it has taken for us as an organization to get to where we are, which is at a progressive state, but is also, like you said, there's so much more to do. But the eating disorder field is extremely homogenous. It's, there are a lot of places where people don't feel safe, and especially people who have been marginalized. So do you have any advice for how organizations and treatment centers can add equity to their strategic vision in ways that are actually going to be helpful?
I think my answer is twofold. I think number one, having someone in leadership who's personally invested in their own work around this, that it's personally important to them, that their values are like oriented around personal interrogation and personal growth. And like if this wasn't personally important to me for many years, you can't expect someone who isn't personally focused on it to do what it takes, I think, to ensure that the organization is committed to it. It can't be peripheral. It has to be center. And so I think looking at leadership and really figuring out what the values of the leadership is and making sure there's someone with some decision-making power who, if I can just swear really quickly, like gives all the fucks. Like that's the most important thing. Because you can't have it be like one line item on a 25 goal sheet for someone who doesn't personally get it. It's just, that isn't going to produce any results. And the second thing I would say, especially for treatment providers and treatment centers and organizations, is like, it pays to give fucks about this. And I don't mean that in a like, this is a profitable thing, but I'm like, there's business value in this. This is not, a trend of the day and a like a passing fad and like something you need to do to like pay lip service to the loud, activists in the space. Like, if you make sure that you care about people who have not been cared about in the past, or who maybe even you haven't cared about, like ultimately that actually helps you. I see so many treatment centers getting reamed and annihilated in social media comments, in press. They're distrusted by people. They're, they've earned a bad reputation for being focused on dominant identities, people who can pay, and numbers, filling the beds and proving profitability and payback to private equity funders. That's short-term vision. Like, if you have a long-term vision of eating disorder healing, tragically, there is a huge customer pool of people you're missing by not expanding your service offerings to include more than 6% of people with eating disorders. And it's like, my first thing is care about it because it matters, have a heart. And the other thing is like, you're hurting yourself, you're hurting your business, you're killing people, but like you're hurting your business by not caring about this more. And it ripples out in brand sentiment, which is another way of saying in your relationship with your consumer base. And, it doesn't work. Like, eating disorder treatment can't be like an exclusive fashion brand that only wants, the top 10% of people to buy it. You know what I'm saying? And so keep it in limited demand and keep eating disorder training niche and exclusive, and only people with this specialized training. It's like every mental health provider should know how to treat an eating disorder that shows up in its outpatient practice. Every single person with an eating disorder should be able to access eating disorder treatment. Until we can do that, there's an ick factor that has a long-term damage to the business. And if you can't have the heart, then know that it's hurting your business. Like, and this stuff matters to a lot of people, even who don't have those identities and even who aren't excluded. It doesn't promote safety in treatment spaces. It doesn't promote trust. And you need that. If you want to get into the underbelly of someone's relationship with their body and with food, the most intimate spaces in a person's psyche, you need trust. And if you don't care about people, or at least put your resources towards creating safe places for all people, you're going to fail. Maybe not immediately, but in the long run. And for what? So you could pay back your early investors on time. I don't know. Doesn't seem like a sustainable business model to me.
That's really powerful. Thank you. I can't wait to share this talk with a lot more people, and this is an important conversation. I'll do a final call for any questions, and we'll start wrapping up. Thank you so much for your wisdom, for your humbleness. I can say, as a Project Heal staff member, having been with Project Heal for almost 10 months, that I, as a fat, biracial, queer, all types of identities person, have felt extremely safe, extremely heard at Project Heal, and am so happy with the direction things are going. I've worked at other organizations and felt unsafe or unsafe to speak my voice and have my voice heard, and that's just simply not the case at Project Heal. So it's making a difference not only in our beneficiaries' lives, but also in the staff, board, and our community's lives. So thank you for doing that.
Yeah, it's an honor and a privilege.
Thank you, Serena. Thank you, Rebecca. That was lovely. And you know, all the work that Project Heal is doing to advance the industry and create access and support families and loved ones and individuals. It's very, very, very meaningful work. So we're deeply appreciative for everything you guys are doing. Thank you so much for joining us today.
Thank you for what Within Health is doing. It's really so important for all the problems that we're trying to solve, that people are putting money and innovation into making eating disorder treatment more accessible. And it's really, really cool to see people thinking outside of the box and coming up with something new. So thank you for what you're doing.
Thank you for that. Yes. For everyone else on the call, we have 2 sessions coming up at 2 p.m. Eastern. There will be a panel covering male eating disorders, some lived experience to advocacy. And then we have our CE session covering trauma, nutrition, and healing through the lens of attachment theory and nervous system regulation. So I believe there's a short break. Hope everyone's enjoying the summit, and thank you for being here today.
Bye.
Thank you.
Thank you.